And then the next question is maybe we can take this kind of any direction, but I'm hoping, can you tell me about one men's mental health issue or project that you're currently involved with? And what excites you about that project when you're thinking about issues of health equity or social justice? I'll throw that in the chat for everyone, and maybe this time we can pick on Francine to start us off.
Sure, yeah, happy to. The work that I'm engaged in, as I mentioned earlier, is community-based participatory research. And this project was kind of twofold. The first part of our project was to conduct a needs assessment of fathering supports for men who lived in the downtown East Side. And again, as I mentioned, these are residents who have faced a disproportionate levels of health inequities compared to the broader general or the broader Vancouver population. So as I mentioned, like a lot of my research is focused on leveraging physical activity. And we know there's numerous benefits of physical activity for mental health, but this is, it's largely not explored, particularly with populations who are experiencing so many competing priorities. So the reason I bring this up is because this excites me, because what we found is that there was a lack of resources and programming specifically tailored to fathers in the downtown East Side context. But also the second part of this was piloting a 6-week family walking program. And I think the success of this program really has motivated me to continue this line of work. What really excited me about it was that the fathers kept showing up. So it was a program that was inclusive for mothers, fathers, and children. And to be honest, we weren't really sure. We had an established program for mothers where we had consistency and lots of people showing up. But the fact that these were folks that were, dealing with, major social determinants of health, but they showed up week after week for a 6-week program. So that really excites me, and it shows me that there is interest and there's sort of, the drive within the community to make that happen. So I'll leave it there.
Thank you, Francine. And I think you presented on that work with me like 5 years ago when I was a master's student, and it's really excited to see where it's gone from since then. Maybe not 5 years, but a couple of years anyway.
Yeah.
But thank you. And maybe we'll go over to Jennifer.
Yeah, I just sent you a message. I'm sorry. Francine was cutting in and out. For some reason, my internet's unstable. So I'll try without video, and you can let me know if I get cut off, and I'll try to pick back up if I do. So a project that I'm really excited about, I have a K award through the National Institute of Mental Health in the US. And this award is to work with couples to reduce intimate partner violence. And the ultimate, the main outcome is to improve women's mental health. But a big part of this project, the whole last couple of years, we've been working on some formative research, doing interviews and focus groups with service providers, community members, elders, men, women, experts in the field, trying to figure out how best to engage men in a couple-based treatment. This is a collaborative project with the Ministry of Health in Mozambique. So I like to present this research with my partner, Dr. Palmira Santos, who's the Director of Mental Health there, but it's the middle of the night for her. So she's going to pass, and I'm going to speak about the project for us both. We find some good results with this intervention, then we can apply this also to HIV care, which has really been a leader in doing couple-based treatment and including men, so that people are testing together, finding out the results together, because it's a big cause of violence between couples. So we've finished analyzing the data. And it still seems like there's a little bit of a question mark about how to engage men, but I think there's also a lot of opportunity. So once we're starting to enroll couples in our pilot trial, and we'll be talking very closely with men and figuring out, how to leverage strengths, how to make mental health, just make it more attractive for men, more interested in engaging in these kinds of services. And we, have several ideas already from the focus groups and interviews. There are things about, a lot about community education, meeting people where they are, getting out of the health clinic. People talked a lot about, knowledge and sharing knowledge of providers with participants experienced as men, that it could be, not only would they be expected to express vulnerability, which is sort of scary, but also like receiving advice. There's a lot in our focus groups and transcripts about what it means to receive advice, and that this sort of diminishes their power. So we're trying to, reframe things and figure out a different way of delivering information. And I feel very excited about that. And even though there's still a lot of question marks,
It's going really well, Jennifer, and then it froze there, but maybe we'll just give it a sec.
can you hear me now?
Oh, yeah, now we can hear you.
Okay, sorry, where did it drop off?
We heard pretty much, I think, right up until the end, and you were saying you're really excited about. Great, thanks so much. And other than that little glitch at the end, your internet was totally fine. I heard you for everything you said, so thanks.
Excellent.
And then we'll go over to Sarah.
Yeah, thanks, Trevor. So I'm also doing some community-based participatory research, which has been stressful but is exciting. And it's a photo voice project with men in New Zealand who have lived experience with depression, anxiety, and suicidal behaviours. And so I asked men to take a series of photographs on their cell phones over a 2-week period that focused on what it's like for them living with mental health challenges, but also what's helped them and what's hindered them in their mental health journeys. What I love about photo voice is it is inherently a method that lends itself to working towards social justice and addressing inequities. For a number of reasons. So firstly, it prioritizes the stories of men through their own lens, through their own words, and enables them through photography to actually capture some of the upstream determinants of mental health inequities and the barriers to their meaningful participation in society. So for example, photographs of poverty, photographs that symbolize racism and discrimination, but also photographs that capture their perspectives of how these inequities might be addressed. And the second thing about photo voice is that men can have their stories and their voices shared back with the community. So I'm currently working on designing an online photographic exhibition which shares the men's stories and narratives as a tool for destigmatizing their experiences and encouraging conversations around men's mental health. And the third part of it that I think's really promising is that because I'm based in Wellington, which is the capital, but it's where our government sits, there's a real opportunity to share the research with local policymakers, particularly within the field of suicide prevention and mental health promotion. So yeah, the opportunity to have policymakers on your doorstep is really quite meaningful, and it's the kind of research that is easy to share, I think, with policymakers. And so yeah, it has social justice at the core of it.
Trevor, you're muted. Had to happen.
Thank you so much. I made it halfway through the event before that. Yeah, thank you, Sarah. And I know we have a few photo voice experts on the call. And I think just before you joined in the pre-meeting, Nina and Francine and I were talking about photo voice. I started it last week for my PhD, and I am also super jazzed and excited about it with those social justice perspectives as well.